So good morning, everyone here. Good afternoon if you're like me and on the East Coast time. It's really an honor to be here today, so I thank you so much for the privilege really to share my 25 years in healthcare experience with you and insights, 21 of which have been in technology. So I first want to give you a little bit of background just from the lens of someone in technology, and it's not the panacea, and that's not what I'm here to tell you today, so I do want to acknowledge that. I do want to say that I think it's important as nurses that we understand what we're up against in the next 10 years, what we're up against in the next year, and what we should really take to heart as we consider the future of nursing 2030. And in our role in really what I've heard called tequity, so technology and equity together. So first of all, one is just rapidly emerging technologies. We saw this morning from Dr. Coyne some of the different areas that technology is popping up, problems it's solving. We know that massive amounts of data are being collected, not only in the hospital, but more and more so outside of the four walls of the hospital. How many people in the room today actually have some type of watch that tracks fitness, steps? I'm sure so many of you, yes. 5 years ago, was that available to you? Did you have it? Maybe Fitbit. So with that, just really an onslaught of data. The second one that really we take to heart at Microsoft is thinking about privacy and security. And along with that, which I heard mentioned really around ethical implications of technology. And we don't have time today to go into it, but thinking about, there's a source out there, it's called The Future Computed. It looks at a framework for ethical use of technology, including privacy, security, transparency, accountability, fairness, and inclusivity. So a framework that really helps us as we, as a technology company, look to understand as we build technology, how can we make it fair and ethical? And one point about that is that nurses should really be involved in that process, in the design, in the development, in the deployment, to give, really to have that different perspective, and not just nurses, but all clinicians. The third point I wanted to make really was around aging populations. I heard this term twice over the past week. I know it doesn't apply to anyone in the room, but it's called the silver tsunami. And actually, UCSF Healthcare Workforce Research Center on Long-Term Care, they actually just released a report last week. It's called The Impact of Emerging Technologies on Long-Term Care and the Health Workforce. And it was a qualitative study that began in 2018, and it indicated, it surveyed population, and it basically indicated that 87% of people 65 or older would like to age in place, at home, or in the community. So with that in mind, we can really start to see where our role as nurses, our role as educators, and really with technology, where it's going. The fourth point here that I think we've heard about this morning, and I've watched the other town halls, is just the increasing patient expectations. And right for this, I just want you to think of yourself as that patient, as that consumer, and thinking about what you do every day that you use technology in, whether that's depositing a check via your mobile phone, whether that's transferring funds, thinking about those everyday consumer activities that when you come into the hospital now, you have expectations that you will be able to perhaps transfer your data from one facility to another, or not necessarily have to log into 5 different portals to access your data. The last one, which I think is important for this group too is just the shortage of healthcare workers. And I was having a conversation this morning with Dr. Cox in my Uber over here, to talk about how can we, first of all, how can we attract more individuals to the profession? How can we educate them, retrain? And I heard some chatter about executive education earlier. But how can we keep them at the bedside? And this was really struck me. She was shadowing a nurse who basically said, I will stay here, or I would like to go to the ICU because when those nurses chart, they can actually sit down. And that was like the one thing that came to mind. So that was very poignant. So digital transformation in health, I'm not going to come up here and give you a tech lecture, but I will say that what grounds me as a nurse working for a technology company really is going back to the quadruple aim, which I know that you're all familiar with. Specifically, the two pillars that speak the most to me. One is just really improving the patient experience. We'll hear about that later on. And then obviously clinician well-being. So I hope that you all are familiar with this, and our job at Microsoft is to see how we can essentially weave technology throughout the care continuum to facilitate this happening. But it's really not that easy. I do want to share with you, I'm going to build this slide up, what we're seeing today. I get to go all over the country right now and really talk about artificial intelligence, and I use that as an umbrella term to include machine learning, chatbots, as well as natural language processing. And I would say that most of the systems, the healthcare systems that I work with, are probably at that foundational and basic level right here. And I think more and more of what we're seeing is that work towards that leader to incorporate social determinants of health into the everyday care. And we are seeing that across healthcare systems, health plans, as well as life science companies, but it's very new. We actually work with a bunch of different startups in this area. One that I have done a lot of work with, Socially Determined, and it's really looking at all of the analytics around social determinants of health. But with all that in mind, I think something that as nurses, as a profession, as healthcare, it sounds great, but how do we actually make it happen? And I think digital transformation is not so much about the technology per se, but really about our culture. I just picked up the Harvard Business Review at the airport yesterday, and on the cover it said, you know, technology, transformation is not about technology, it's really about culture shift. And so I think this is so huge for healthcare as an industry, quite frankly, because we are behind the time. And we, as nurses, are critical in this transformation, whether you work in industry, whether you work in a hospital, in a clinic, at home, whether you're seeing a patient virtually. It's really up to us to ensure that this happens. And it doesn't mean going out and buying the latest and greatest technology by any means, because what I've seen in many different facilities is we're still working on communication and collaboration. And I had the opportunity to actually shadow a nurse basically examining the process of medication ordering through fulfillment to delivery. And the gaps in that care process were really communication. And so how can we utilize technology to make that happen? And finally on this slide, I wanted to say that, and I saw this in someone else's presentation, but Peter Drucker famously said, culture eats strategy for breakfast. And so as nurses, I think we need to be learners throughout our career, whether that is in an undergraduate situation, whether that's on the job. You don't necessarily have to go back and get that advanced degree, but we encourage it. And again, I'm going to go back to the point that we really need to be at the table and in part of that process. So how do we tackle that challenge? I'm just going to spend the last few minutes here really showing you an example of what I've seen in the market. Actually, and I will show you, we're going to show you a quick video here of an example that was led by nurses actually at Children's Mercy in Kansas City. And I didn't pick this example because I knew Karen Cox was here, and she's the former COO. It had nothing to do with that. It's actually one of my favorite examples of how IT, patients, the nurses, and the tech company work together. You can play that video. And I'm going to tell you a little bit about it while we're waiting. So essentially, it looks at, it's called the, here it comes. Coming across the screen. They told me to have a backup plan, so.
I think in the back of each of our minds, we were planning a little funeral, and just didn't know where it would go after he was born.
We'd hear a song on the radio, and we'd be like, maybe that's one we'd like at his funeral.
Winston was diagnosed with HLHS, which is hypoplastic left heart syndrome.
1 in 100 to about 125 babies are born with heart disease every year. And out of those, about 1% are born with half a heart. Out of all the heart surgery we do, this is the most high risk.
They lose about 25% of these babies in between the two surgeries.
The standard of care at the time was to send these families home with a weighing scale and a pulse oximeter and a 3-ring binder, and they were asked to record measurements of their baby every day.
So we needed a method that we could actually send something home with the parents so that we could better monitor and be alerted if there were conditions that we were concerned about with the patient. We have a Microsoft Surface that we load our software on. We call it CHAMP. We decided we wanted to use a modern app with Windows 10 as the operating system.
We would log all of his vitals, and that app became this seamless piece to his care.
With the daily reports that come in from the Azure cloud, if anything is an outlier that needs to be notified to us immediately, it'll alert us.
One night, we're debating, do we call, do we not call? But we logged it in.
When we were looking at his information, he had a couple days of not gaining weight. He was breathing a little bit harder, and he just wasn't happy on his video.
They could pull it from when he was doing fine and saying, okay, a couple weeks ago, this is what he looked like. Now he looks like this. We think it is part of his aorta.
We were scared. It was real fast.
They did the procedure the next day, and then I think he went home the day after.
This technology literally saved his life.
The first time that I heard a child's life had been saved with CHAMP, I left the room because I kind of needed to tear up in private, because it was a dream that I'd had for a long time.
The goal is to get this out to as many patients as possible so that we can help save kids' lives throughout the world eventually.
For everyone behind the scenes, we're very thankful for it. Saved his life, and how do you say thank you for that?
All right, can we go back to the slides? Again, this is actually something that I would consider somewhat low tech, common sense test. So I consider it, it started really as low tech, essentially taking something that was in a 3-ring binder and putting it on a in an application. And now it started at Children's Mercy in Kansas City, and it's actually in multiple sites throughout the United States. They've collected over 110,000 data points, over 6,000 videos of babies, and it's actually, there's a publication that I have the, thank you, reference for right here. And it also won the 2016 Magnet Prize, which awarded the institution $50,000 to continue with the nursing research. So this is one of my favorite tangible examples. I know we're out of time, so thank you guys so much. There's so many more I could share with you today, but this was something that was nurse-led, and I felt strongly to share it with you, so thank you.